expert, and today we're talking about diversity. And I wanted to talk about this. I feel like the universe constantly brings me exactly what I need to bring you guys a message. And that last week, I don't know, maybe midweek last week, I got a comment on one of my old videos where I talked about the importance of diversifying medicine and how, right, the Supreme Court's decision last year to essentially make affirmative action illegal was a step in the wrong direction. And there was a comment on that post that said, oh, now you guys will have to get in on your own merit instead of taking the spot of more qualified non-minorities. And I was like, ooh, I wish this person would actually listen to the video and what I said and understand that there are not nearly enough minorities to even consider saying, oh, we're taking spots away from anybody else. Minorities don't get into medicine. And so that happened. And then this weekend, I went to a conference. I went to my Anesthesia Society conference, get my continuing medical education units, connect with my colleagues and so forth. And of course, you guys know me, I love diversity. I love promoting, health equity. And so I went to the diversity, the DEI session. It was a big panel they had with all these residency program directors, all these deans of diversity and so forth. And they were talking about the diversity issue in healthcare and best practices for promoting diversity. And they left me with this statement, which I want to read to you guys because I couldn't believe it when they said it. But I'm going to read it because it's a very strong statement. And that's what sparked me to do this today because I think it's important that we talk about this. But essentially, the ACGME, which is the accreditation certificate, whatever, something, graduate medical education. Essentially, do all the accreditation for all of the graduate medical education programs like residencies, fellowships, and so forth. This is a big entity. It's like the AMA, right, but for the graduate medical education. So these are all the people who run residencies, who run fellowships, who are in charge of all the administrative stuff of controlling our highest end of the healthcare pipeline. And their joint statement is, we don't control the entry of students into medicine, so there's nothing we can do to advance diversity. And I thought this was, wow, that's a strong, strong statement to say, but it is actually, I wasn't shocked to hear it because what I've been saying about so many of the interventions we have that are fruitless, that don't move the needle, and the fact that we've had no diversity for forever. So today what we're going to do, we're just in a series because I was like, okay, I could really blow this out, but it'd be too long for one session. You guys don't have that kind of attention span. So what we're going to do today, we're going to start, this is part one. We'll see how many parts we get to. Part one of maybe part two, part three. We'll see if we're gonna do 2 parts or 3 parts. But this is part one of us talking about diversity in medicine and having a real talk, cutting through all the fat and the BS and the fluff and getting to the crux of, we have a diversity issue in healthcare. Why is that problematic for patients? Why is it problematic for providers? And then how can we go about changing that at a systemic level and then also at the individual level to make it so that we create opportunities for minority pre-meds, minority physicians in training, minority physicians, and then minority attendings at the highest level of that spectrum of becoming a doctor. All right. So yes, short attention span, I got you. Yes. So Hank said, I got a short attention span. I understand, Hank. So many students do. That's what we're doing. We're going to bite it up. So today we're going to do part one. I'm going to hit the intro, then we're going to get right into it, guys. But stop making excuses, stop whining, stop, right? Get at it. No excuses, just dominate. All right, like I said, guys, Dr. Pinesett here. Always bringing you positivity, productivity, helping you be the best pre-med, best medical student, best doctor you can be. This is a channel of transformation. Transformation, y'all. We're trying to get better. If you are here, if you are tuning in, like the video right now, comment, hey, Dr. Pinesett, I come here to get better. Teach me something today. Educate me. Don't fill me with empty, false rhetoric. Give me the truth because I want to move forward. I want to change this world for the better. And that's what we're going to do, guys. We're going to start here. And I was going to redo this and essentially just talk about it. But I was like, you know what's better? Sometimes you need to see things. Because as I talk about it, there's a lot of things happening, but I wanted us to be able to see it. So now everybody, this is the ACGME's approach to diversity and inclusion at the graduate medical education level. So this is a joint PowerPoint put together, and you can see it's the Chief Diversity, Equity, and Inclusion Officer. This is an MD, PhD. So it's the Accreditation Council. That's what the word was, accreditation certificate. Accreditation Council for Graduate Medical Education. So these people are in charge of all the residencies and fellowships and ensuring that our residents are doing what they're supposed to be doing, they become qualified doctors and so forth. And so this PowerPoint was put together and it's very telling. And so where we're going to start with this, before I can tell you about how to increase diversity, one of the things I keep bumping up against is that we don't understand the significance and the importance of promoting diversity in healthcare providers. Healthcare providers provide care for people at their most delicate, most sensitive, most fragile, most, right, literally life on the line moments. And so it's important that we provide the highest level of care. And as part of that care, it has been proven time and time again that diversity in physicians matters because our society is ever increasingly becoming this big mixing pot where there is just an abundance of diversity. So if our provider percentages don't match our patient and population percentages, we're going to have a disconnect in care and we're going to have inequities in healthcare. And we don't want inequity in healthcare. If you're a patient, you want, right, all healthcare to be equal. You want to get the highest level of care that you can receive. And so where we're going to start with this, I'm going to outline to you quickly what the problem is with a lack of diversity in our workforce. And I think we can start with this slide because it says a lot with a little bit. I actually love this PowerPoint. I hate the message of the PowerPoint, but I love this PowerPoint because it's so spot on to really what the issues are that we are facing. And this here, unequal treatment, is 584 pages. I love that detail of it because you have to understand just how involved this is. It's 584 pages, more than some textbooks, detailing the extent of racial and ethnic differences in health outcomes that are not otherwise attributable to known factors such as access to healthcare. This is so important because now you have 580 something pages outlining the fact that if you are of a certain ethnic group, if you are of a certain race, you are predetermined to have poor and unequal treatment in your healthcare environment. All other factors aside, like access to healthcare. And I think that was such a strong statement because so often we attribute a lot of the inequities between races, between ethnicities in healthcare to access and care. Oh, if we just have more access, it's there. It's the same thing that happens when we have like food deserts. Like, oh, if we just put more grocery stores, then you know what? All inequities will disappear. There are so many factors outside of that, systemic factors that prevent equal treatment, equal care, equal opportunity. And as a society, guys, it's so important, guys. It's 2023. Equality? We can't get equality, equal treatment, equal opportunity? It's crazy. Disparities consistently found across a wide range of disease areas and clinical services. So it's not one disease, it's not one area, it's global. It's throughout every morsel of healthcare. There are disparities and they can't be accounted for and just waved away. They are problems. These disparities are found even when clinical factors such as stage of disease presentation, comorbidities, age, and severity of disease were adjusted. So you can't say, oh, you know what? Then Black people wait longer to come in and get care. Oh, you know what? But no, you can't because we control for that. Disparities are found in a wide range of clinical settings, like I said, and associated with disparities in care are associated with higher mortality among minorities. Meaning these disparities, they're not like, oh, you know, it's unequal, but you know, all things considered to be all right. No. Everyone, listen. Disparities in this care are associated with higher mortality among minorities, meaning these inequities kill minorities. We're talking true life and death impact on our healthcare system. So when someone tries to make the argument to you like, oh, we shouldn't push diversity in medical school, we shouldn't push diversity of physicians. Oh, what color a physician is and what race they are, it doesn't matter. Wrong. It matters. It's a matter of life and gosh darn death. Because if you are a minority, you are more likely to die. All other things considered, you're going for the same condition, you're more likely to die than your non-minority counterpart. That's not acceptable. That should end all arguments, right? We should be like, oh snap, we're gonna do whatever it takes to promote diversity. We should do that, right? And yes, we are live action, Robert. We are live action. Who's live action with me, y'all? We're live action, YouTube, live action, Facebook, right? Premier Productivity Podcast, bringing you guys real stuff. And we're just getting to the meat of this. I know we're 10 minutes in, but there's a lot to unpack here. And I find so often, if I just start to go into what we can do to fix it, so many people are going to watch this video and not give a crap. They're not going to understand that, oh, you know, I'm not minority, it doesn't matter. It should matter. If you're someone who wants to go into healthcare, if you're someone who wants to give of yourself for other people, if you're truly a humanitarian, a humanist, this matters because we want to save lives, y'all. As they say, society must view healthcare disparities as a deficiency in healthcare quality. It's not about the individual student. When we talk about promoting Black physicians, we talk about promoting Latinx. I like to say Latino, but I guess it's Latinx now to be correct. I don't know, right? It's like when I say, hey guys, it's like, oh, I'm not offending ladies. I'm just saying you collection of people, you gaggle of people. Okay, but anyway, we must view this as a deficiency in healthcare quality. Health equity is a means to achieve elimination of healthcare disparities. And one of the key ways we have to do this is increasing workforce diversity. That's a principle of it. And we have to create inclusion. We have to figure out how to bump those numbers. And that's the great riddle. And that's really where we're going to get down to this, right? Why does diversity matter, right? Is that, listen, we all have different cultures. We all have different views. And because however we were raised, our cultural upbringing, our experience, the color of our skin, it shades us, it shapes us, and it makes us who we are. It creates our perspectives on life and on other people. And so it matters that you have that cultural sensitivity, that cultural understanding. You can see things from a vantage point of the minority. And it turns out that minorities understand that non-minorities often don't see them the same, often don't look at them the same, often don't, right? If you're a minority, right, you can comment in the box right now. How many of you guys as minorities have experienced direct, to your face, blunt discrimination, bias, racism? I'll start. Me, right? Me. when my med school advisor, my actual med school advisor, person in medical school, crossed the street on me because you saw a Black person coming in the late evening. I was like, oh, hey, it's just me, your student. Don't cross the street on me, right? Frank discrimination. We've all experienced it. If you're a person of color, you know what that is. And so we have to understand that because of that, we are a bit guarded amongst non-minorities. Fair, right? We feel judged, we feel, right? And so because of that, if there's an uneven power dynamic in the sense that I'm going to seek care in my most vulnerable moment, I'm about to show you a lesion I have on my rectum, right? What's more sensitive than that? I feel like I'm dying in this moment. I'm putting my life in your hands. What's more sensitive than that? Hey, I'm a father, I'm a mother, I'm coming here for the birth of my child. My child's life is in your hands. What's more sensitive and delicate and high value than that? And so now, if I'm a person of one ethnic background and I see a person of another ethnic background, if I'm a minority and I've had certain experiences, it shades me and there's a slight distrust or maybe a major distrust. And that results in a disconnect. And so we need to have providers that match that population to create trust, to create open lines of communication, open lines of cultural understanding, and it matters. It matters. Okay? Students who are from minority groups tend to serve in underserved areas, tend to serve in areas with minorities. So that helps with access to care. But not just that, what's also important is that when you go and you serve in these communities, not just from the provider side and access to it, this is what matters, is that when there is racial concordance among the provider, meaning the providers of the same racial or ethnic background makeup as the patient, there's a higher level of trust. And as a result, you see that physicians treating Black patients reported greater difficulties, right? Physicians treating Black patients reported greater difficulties in obtaining access for their patients to subspecialties, diagnostic care, blah, blah, blah. And so essentially, a Black physician was 40 times more likely to see a Black patient than was a white physician. 40 times. When we look at this and the difference in care, chronic pain, right? We've got an opioid epidemic because pain is real. We feel that pain, right? We've got problems. Black subjects were likely to talk with a Black doctor about more of their health problems. I got all these issues, but I'm only going to talk to you about the ones I feel comfortable with. Instead, if I see another Black physician, it was one of those moments in life that you remember forever. When I became a physician, I was an intern and I was working and I'm in primary care clinic and I'm going to see my patient, and my patient was this older Black gentleman. And he's like, he startled when I walked in the room, and he's like, "Are you my doctor?" And I'm like, "Yeah, I'm your doctor." He's like, damn, I ain't never seen you around here. And I'm like, oh, well, I'm here. He's like, you're the first black doctor I've seen, I've ever been treated by. And I'm like, well, I'm here. And we had this whole long conversation, whole long dialogue. And he's like, man, he's like, you gonna be here next time? I'm like, actually, no, I'm rotating out next week. He's like, oh man. He's like, because I feel like I come here and I've seen that one lady, but she's an Asian doctor. She doesn't understand a lot. And whether it's true or not, it's the perception, right? He didn't feel comfortable with his previous doctor, but he instantly felt comfortable with me. He felt comfortable discussing. He felt comfortable sitting down. He felt comfortable letting his hair down, right? And talk about some things. And so it makes a big difference. Black doctors were more likely to write additional notes on subjects, right? The disease was significant in improving cardiovascular disease, right? And black people die, right? Salt kills these black people. Sugar kills these black people. Look at this. Diabetes, cholesterol, cardiovascular disease, all improved with physician concordance. All the major killers improved. Patients see themselves in their physicians. Oh, you're like my son. You're like my cousin. You're my people. You're here for me. I understand. I feel it. And I'll just say as a sidebar, this is a real thing. This is a real thing. We were watching a show, this game show. We were watching, who's ever seen Legends of the Hidden Temple? Can I sidebar? Can we everyone like the video right now? If you want me to sidebar, say, hey, Dr. Pinesett, sidebar. We want to hear a real perspective on this. I was sitting down watching Legends of the Hidden Temple. So this is one of the beauties of streaming services now, is you get all the stuff on demand, but you also get all the old stuff. So when I grew up, I was watching Legends of the Hidden Temple, right? And it was this great show on Nickelodeon, and you had to race to the temple and stay away from temple guards, whatever. And so they have like the silver monkeys and the blue barracudas and I think it was orange monkeys, silver swordfish, I don't know, something like silver snakes, all those kind of things. And so they have like 8 teams. And I'm watching it with my kids, and I'm like, yeah, who are you guys rooting for? And my son goes, I'm rooting for the silver snakes. And I'm like, oh, cool, why are you rooting for silver snakes? And I already know. There's the black kid was on the silver snakes. We just feel that. It's just like innate. Like, it's like, oh, those are my people. I identify with that. Right? So anyway, patients want this concordance, and it matters. All this are we good with this? Have I shown you guys that it matters from a care perspective? Can I exit this and now we can actually talk? Okay. As I present all of these facts, right? I present all this data. Again, we have to open our eyes to the perspective of this. And it goes both ways. And I'm not going to let my minority people off the hook either, because we're going to talk about that too. But it's so important for everybody who's not a minority to understand this is not about race. This is about humanitarianism. This is about saving lives. If you are truly someone who says all lives matter, if you are truly someone who says I got into healthcare to help people, to help everyone, then you need to take up the flag and say diversity matters. You need to lead the charge, even if you are not a minority. And it's one of the things that this panel was talking about. They're like, listen, we don't have enough people of color at all of these residencies, at all of these medical schools to have a person of color leading our diversity programs. And it was hilarious because of this panel, there were like 4 DEI, diversity and inclusion officers who were Asian or white and said, listen, we just don't have any minorities in our program. So I care about this. So I'm taking up the charge. And it's so important that these allies, right, that these people, if you are not of a minority basis, you are a human being, and you should be able to understand that we need to champion this. And so take it upon yourself to champion this, to spread the importance of diversity in healthcare. With all that being said, what I will end with, and I like this, I'm not going to scroll, I'll read it again though, what they said here. We don't control the entry of students into medicine, so there's nothing we can do to advance diversity. Think about that, guys. Here you have graduate medical education leaders telling you, we don't control the entry of students into medicine, so there's nothing we can do to advance diversity. They're saying, we recognize, we're so close to the clinics, we know that diversity of our physicians and our providers, it matters, it saves lives, but we are at the same time helpless to help these patients. We are helpless to move the needle on diversity because we don't control the entry of students into medicine. So now the question I'll ask you guys as a group, right? This is interactive, right? We're at 20 minutes. Can I keep going? Or should we break it? Can we keep going? If you want me to keep going, say, Dr. Pinesett, keep going. Keep getting at it. Say, I'm not going to butcher your name. I apologize, but say Warren. Say Warren. I have terrible pronunciation. I apologize. I'm going to say Mr. Williams because I see a gentleman sitting there. Mr. Williams asks a great question. We can sidebar. Can we sidebar? And I love this. I'm gonna pull it into the stream because I like this. I'm gonna pull it on here. Oh, there we go. Boom. Is there a danger of segregated healthcare as a secondary effect for both clinician and clinician? I think you're saying for patient and clinician. Pull this back on here. For both patient and clinician, similarly with minority physicians relegated to underserved areas. And I wanted to pull this comment in here because this is so important. So I had lunch with one of my students who's in medical school. And so he came down, he shouted for a little bit, and then we sat down, we had, a couple hour lunch, and we were talking about his experience in medical school. And one of the things we talked about was just that because we recognize that we need more minority providers, particularly we need more primary care minority providers, there is a push for many of these minority programs to push their students into primary care. I was telling my student, don't listen to those knuckleheads, go into specialty care. And this is a whole sidebar discussion we can have, a whole no doubt, a whole video about this. But this is so important. You should do the specialty you choose in medicine, you're going to be doing for the rest of your life. 4 or 5 decades. 4 or 5 decades. You should not pick a specialty that you don't enjoy. You should pick the specialty that you enjoy the most. And as part of that, you must look at why you're going to that specialty. And you must be selfish in that because you're going to have to do all the work required in that specialty. If you choose primary care, even though your heart is in surgery or is in OB-GYN or is in radiology, whatever it might be, you are going to be miserable. And so you are going to be less good to your patients than you could be in another specialty. The other thing is if you are a specialist, you will make more than your primary care counterparts, period, in a discussion. By making more money per hour, it allows you and it frees you up to have more money to give if you work the same amount of hours, and or it frees you up to have more time to give on the back end, the other way. So if you create more time for yourself, it allows you, as we're going to talk about later, to build yourself into someone who's an amplifier, an activator of minority future doctors. And this is such an important point. If we're pushing the importance of diversity, we're pushing the importance of diversity not for segregation, but for actually integration. Because if we have a diverse workforce, then it gives patients the options to go to any clinician they want. And by having more physicians of color, it allows these physicians to spread an understanding of the minority mindset to their colleagues, and thus it actually will create more segregation and more of an awareness and understanding and more fair treatment amongst non-minority physicians with their minority patients. Does that make sense? Does that answer your question, Mr. Williams? I'm trying to get to it slowly. But essentially, if you create more physicians of color, you are then creating an atmosphere, an opportunity for non-physicians of color, non-minority physicians to interact with their peers who are minority and have those peers explain to them what the minority experience is. And to create a cultural understanding and a cultural sensitivity amongst other providers that then is going to encourage and facilitate a more whole, well-rounded and encompassing and equitable healthcare environment. And to my point about primary care versus specialty care, why I bring this up is because many minorities think I have to go into primary care if I care about minority health. But the reality is just like that slide set up above, referrals to specialty care, we need physicians of color in all specialties. all specialties, not just primary care, because we need cardiologists. We need the surgeons to operate and treat us fairly. We need the endocrinologists to handle diabetes. We need all of these specialists as well. So I encourage all of you guys to pursue the specialty that you want and know that with any specialty, you'll be increasing diversity and therefore you'll be helping patients. Okay, Rain. Okay, got it. Perfect. Thank you. Okay, Rain. Does that make sense to everybody? I hope that makes sense. I know I rambled on there for a little bit, so we got to make sure we clarify. We're at 25 minutes. We're going to go 5 more minutes because I have Dominate Pre-Med, Total Pre-Med Transformation coaching today with my students. So I got to get off here so I can go meet with my coaching students. But for this part 1, actually, I think let's stop. I was going to get into. Okay, so here's what we're going to do 2 parts because I'm going to pack it in on the second part. So for this first part, we're going to end here. We've now laid out the issue. We've laid out the problem. We now, after this end of this video, you should have a clear understanding of, oh snap, this is a humanitarian issue. We want to create equity. Every single human being on this planet should be treated equally. I'll say it and I'll say it right now. I have biases. I have racial tendencies because I am a race. To ignore the fact that we all have a race is ignorant, right? I am black. My student Spencer's on here right now. He is white. But we are like this. We are simpatico. I also, Spencer, I finally checked my mail and I got the gift you sent me. Thank you so much. I appreciate that. It means a lot to me. The letter you sent and also the statue is amazing. It's up in the front of my house. My kids love it. So thank you for that. But he is white and I am black and we are like this. So just because I am black and I'm aware of my blackness, I'm aware of my biases, and I'm aware of the bias that's out there, and I'm aware of racism and so forth and all those things, doesn't mean I can't care for, love, and value white people. But in a world, we can't pretend that race doesn't exist. We have to acknowledge it, and then we have to have a common understanding of what that means. So that way we can come together. We want to come together, not segregate, we want to integrate. Okay? So today we've laid out the problem. My challenge for you guys, my test for you guys is, can you be an advocate? Can you be an ally? Can you be an educator? Can you spread some of the information I've shared with you today? Share this video, as a matter of fact. Share this video to your feed, to your social media. Share the information. Let people know this is not about race. This is about humans. This is about equity. This is about saving lives and giving everyone the same opportunities that we should all have. Right? That's where we start. Next time, I'm going to explain to you guys why, and maybe I'll show you the slide. This is a cool slide to look at. I'm going to show it, and I'm going to tell you this is what we're getting into next time. Because I listened to this panel, and it's the same problem I have. I go to all these conferences. I hate listening to these characters talk about diversity because they don't have any gosh darn clue on how to actually promote diversity and improve diversity. I want you guys to look at this. This is pipeline graduates over the last 15 years. And we don't have to look at the whole chart. If you look, the color bars don't really change very much, right? We see the overall number going up, but if you look at the percentages, these are by race, they're all the same in our healthcare pipeline since 2004. What's crazy is if you extend this graph all the way back to civil rights, 1960 something or other, it looks almost the exact same. Looks almost the exact same, right? Asians keep going up, but everything else is right on the money. And if you look at the black, right? Look at this green bar, the black people. Not only are we not going up, we're actually going down, y'all. We're at 5.1. This is important. We are making zero dent in diversity. We are not increasing diversity at all, despite spending lots of money, lots of time, lots of chatter on diversity. We are not moving the diversity needle, not 1 millimeter. We have made zero, I'll say it louder, zero progress in increasing true and meaningful and substantial and significant healthcare diversity. Our doctors are not more diverse today. And it's because of 2 primary issues we have. Next time in part 2, I'm going to tell you what these 2 issues are, how we're approaching the problem wrong in 2 major ways, and I'm going to give you 4 solutions to these problems so we can make massive action, massive change, and flip the whole paradigm and truly make significant changes in diversity. This next talk is not going to be for the faint of heart. It's going to be hurtful to some people's feelings because there's a lot of people out here working in diversity and inclusion activities, and they aren't doing jack crap. And I'm going to call them out for it. And then I'm going to explain to them just how wrong they are and how we can get right. And I hope that people don't let my harsh tone, because it's a serious topic to me, don't feel hurt feelings. Have a clear understanding of what is right and what is wrong. And what we've been doing to increase diversity is wrong. It's, excuse my French, ass backwards. And we have to fix it. And next week, I'm going to show you how to truly fix it. I appreciate y'all for joining me this week. I'll see you guys next week, same channel, same time, right? 4:30 Pacific time on this channel. I'm going to break down to you how we're going to make that needle move and how we could instantly, not instantly, but very quickly in the next couple of years, we could double the amount of minority physicians. We could double the amount of minority medical students in the next couple of years if we make these changes. Very powerful stuff. Coming up next time. Thank you guys so much. My dominant pre-med students, I'll see you guys in coaching right now. Everyone have a wonderful evening. How do we always end? No excuses. Just dominant, y'all. Everyone have a wonderful day. Peace. That's it for another episode of the Pre-Med Productivity Podcast. Show your love by smashing the like button and commenting in the box below. Today is the day, guys. No more excuses, no more complaining. You're going to take your future into your own hands. You're going to dominate. You're going to be successful.